Hi, this is the continuation of a series of videos designed to give individuals information that they can use to prepare for a visit to a physician's office. The videos are designed to help ensure that the individual can ask appropriate questions of the physician and to increase the likelihood that quality care is delivered. Headache is a common complaint in primary care office visits. There are many causes of headache. Therefore, the physician will take a thorough history before doing a physical exam and ordering any testing or imaging. A common cause of headache is a respiratory infection. A tension headache is also a common cause. Sinusitis, the inflammation of the sinuses, must also be considered. Migraine is a frequent cause of headache, but it is not as common as the advertisements on television would make you believe. Some headaches indicate severe disorders, so it is critical that they not be missed by the physician. Some of these that should not be missed are a subarachnoid hemorrhage, the bleeding into an area that covers the brain. It is a life-threatening event. It can be caused by a head injury, but that is not the only cause. A subdural bleed, which is bleeding into another area of the coverings of the brain. A subdural hematoma is most often the result of a severe head injury. The bleeding fills the brain area very rapidly, compressing brain tissue. This often results in brain injury and may lead to death. Meningitis, an infection of a covering of the brain. A mass or cancer of the brain. Temporal arteritis must also be considered. It is also called giant cell arteritis. It is an inflammatory disease of blood vessels. Symptoms may include headache, pain over the temples, flu-like symptoms, double vision, and difficulty opening the mouth. Complication can include blockage of an artery to the eye, resulting in blindness. These must be considered when evaluating a headache. The physician will ask questions in order to get a handle on the characteristics of the pain. Where is the pain? Does it radiate? If yes, where to? What is the frequency of the headache? How long does it last? Does it come and go? What are the precipitating factors that produce relief? How severe is the pain? Is the pain sharp or dull? Any accompanying symptoms? Do you feel nauseated? Have you vomited? Does light affect your eyes? Does your nose bleed during headaches? Have you had recent sinus trouble? Have you been under stress lately? Did you recently bump your head? Do you have a history of high blood pressure? The physical exam will include the inspection of the head, including palpation of the temporal arteries, inspection of the sinuses, teeth, and the joint that connects the jawbones, inspection of the eyes with an ophthalmoscope. One of the things the eye exam may show is papilledema. Papilledema is a condition in which increased pressure in or around the brain causes the part of the optic nerve inside the eye to swell. Inspection and palpation of the facial and neck muscles. The cervical spine, the part of the spine that supports the neck. The physician may order a hemoglobin level to rule out anemia, a white blood cell count to rule out infection, a sedimentation rate, which is used to rule out inflammation for the possibility of temporal arteritis. Imaging studies may also be ordered by the physician. A CT or MRI to rule out a mass in the brain, a bleed in the brain, or a bleed between the membranes covering the brain, such as a subarachnoid hemorrhage or a subdural hemorrhage. The physician may also do a lumbar puncture if meningitis is suspected. Again, meningitis is an inflammation of one of the coverings of the brain and spine. This can be caused by a bacteria, virus, fungus, or other causative agent. In a lumbar puncture, a needle is inserted between two of the vertebrae of the lower back. in order to remove a sample of cerebrospinal fluid. The cerebrospinal fluid is the fluid that surrounds your brain and spinal cord to protect them from injury. Well, I hope this helps. Have a good day.